Hello everyone, how are you all? I hope you are all fine and doing well. So, today we all are going to learn about disaster management, how it affects our life, financial situation, social services, and how we have to manage it.
Definition of disaster. A disaster can be defined as any occurrence that causes damage, ecological disruption, loss of human life, deterioration of health and health services on a scale sufficient to warrant an extraordinary response from outside the affected community or area. It means that disaster is a life-threatening condition and causes many losses. Now we see each word has own meaning of disaster. D stands for detection, I stands for incident command, S stands for safety and security, A stands for assess hazards, S stands for support, T stands for triage and treatment, E stands for evacuation, R stands for recovery.
Types of disaster. There are mainly two types of disaster. First one is natural disaster and second one is man-made disaster. Natural disaster. Natural disasters are further subdivided into four categories. First category is tectonic telluric. It means disturbance of magnetic field of the earth. We can say geological hazard. It includes earthquakes, tsunami and volcanic activity. Second category is typological. It includes landslides, avalanches, mud flow and floods. Third category is meteorological hazard. It means extremely change the weather. It includes different kind of storms like cyclones, typhoons, tornadoes, hailstorms, snowstorms and cold spells, heat wave and droughts. There is little difference between cyclones, typhoons and tornadoes. Fourth category is biological hazards. It includes disease epidemics and insects or plague-placed communicable disease. Recently, COVID-19 pandemic is an example of biological hazards. This picture shows the different example of natural disasters. Second type is man-made disaster. Man-made disasters are further subdivided into four categories. First one is warfare. Warfare includes conventional warfare and non-conventional warfare. Conventional warfare means bombardment and blockage. It is any kind of civil terrorism or civil conflict. Second category is civil disaster. It includes riots and demonstration. Riot means a violent disturbance of the peace by the crowd or number of people. Third category is accident. It includes transportation, structural collapse, explosion and fires. And fourth category is technological failures. It includes mishap at a nuclear power station, leak at the chemical plant causing population, breakdown of public sanitation. This picture shows the different example of man-made disaster. Next is principle of disaster. There are various types of principles in disaster management. First, prevention of disaster, minimization of casualty, prevention of further casualty, prompt action, rescue the victims, immediate first aid,
evacuate the site, provide care and refer, rehabilitate, reconstruction and recovery, capacity building, and last, knowledge management, research and development. Effects of disaster. It completely disturbs the normal day-to-day life. It negatively influences the emergency systems. Normal needs and processes like flood, shelter, health, etc. are affected, deteriorated depending on the intensity and severity of the disaster. It may also be termed as a serious disruption of the functioning of society, causing widespread human, material or environmental losses which exceed the ability of the affected society to cope using its own resources.
Now we will see disaster management cycle, which includes disaster impact, relief response, recovery, rehabilitation, reconstruction, development, prevention, mitigation, and preparedness. Out of this, the main two are crisis management and risk management. So we will learn each and every terms of this disaster management cycle. So first of all, disaster impact that affects the disaster or the people, financial, economical or the society is referred to as the impact of the disaster. Second is relief and response that continues to beyond the emergency period and the efforts shows by the disaster management team to reduce the vulnerability of the victims. Number third, recovery, the coordinated process of supporting disaster affected community in rebuild their physical infrastructure and reconstruction of their emotional, social, economical and physical well-being. Number 4, rehabilitation. It is an action taken in the aftermath of the disaster to enable basic services to resume the functioning, assisting the victims, self-help efforts to repair the physical damage, restore the community facilities, resolve the economic activities and provide support to the victims. Number 5, reconstruction. Rebuild the physical infrastructure and the full resumption of the socio-economic activities plus preventive measures are made. Development phase. It is the phase in which the victims are taught to beginning their new life and help to cope with the disaster. Number 7, prevention. Those activities taken to prevent a natural phenomenon or the potential from the hazard from having harmful effects on either people or economic aspects. Number 8, mitigation. It is the process to minimize the effect of disaster on the community. And number 9 is preparedness. It is a plan to how to make response in respect to the disaster.
Phases of disaster management. There are mainly 5 phases of disaster management. Disaster preparedness, disaster impact, disaster response, rehabilitation, disaster mitigation.
So now, first of all, we will see disaster preparedness, vulnerability analysis and mapping to include resources, assess strengthening requirement and execute, create lead time by interpreting warnings, plan to include moments of resources with time frame, aim to reduce the destructive potential of disaster, timely and appropriate relief to victims and quick and durable recovery.
Preparedness activities are designed to minimize loss of life and they meant, for example, removing people and poverty from a threatened location, facilitating timely and effective rescue, relief and rehabilitation. Preparedness should be in the form of money, power, manpower, and materials. Evaluation from past experience about risk location of disaster prone areas. Organization of communication, information and warning system. Ensuring coordination and response mechanisms. Development of public education program. Coordination with media, national and international relations. Keeping stock of foods, drug and other essential commodities. Creating the disaster prevention and response plan. How does the plan goes? A sound disaster prevention and response plan reflects common and the unique needs of educators, students, families, and greater community. Preparedness to spot the behavioral and emotional signs that indicate a child is troubled and strategy to help them. Use of school and community resources to create safe environments. Manage of response to acute threats and incidents of violence. Forming prevention and resource team. The core team includes in the school the administrator, general and special education teachers, parents, school psychologist, social worker or counselor, doctor.
Disaster impact. Disaster affect our life in many ways. The effect it makes can also be termed as impact of disaster. Impact of disaster could be impact on human life, impact on economy, impact on ecology and environment, psychological impact, social impact, health impact. Disaster response. It is actions is taken in anticipation of, during and immediate after impact to ensure that its effects are minimized and that people are immediate relief and support. It includes all the measures during or immediately before the disaster. It deals with the site action. Take immediate and adequate steps to deal with any emergency. Response team includes various forces such as police, fire, medical and so forth. Multiple aspects of impact are as follows. Search and rescue operation. It is order or command to rescue and search out. Need assessment. Find out what is the need like food, drug or any emergencies. Triage. Medical assistance and managing mass casualty. Emergency relief. Logistics and supply. Communication and information management. Provision of food, drinking water, sanitation and clothing. Transportations and referral. There are mainly 5 A's which are included in disaster response. S1 sense of safety. S2 sense size up. S3 send for help. S4 setup. S5 start or jump. Rehabilitation. Rehabilitation plays a crucial role in natural disasters owing to the significant upsurge of survivors with complex and long-term disabling injuries. Rehabilitation professionals can minimize mortality, decrease disability, and improve clinical outcomes and participation. It is providing immediate and adequate care per the minimum standards. It includes restoring conditions at the maximum level. For example, this picture indicates different kind of stages. First stage is normal. In second, disaster is occurred, and third stage is rehabilitation and reconstruction. The setting of relief camp, which have the provision of drinking water, bathing and sanitation facilities, essential health services and food through community kitchen. Rescue relocation, preventing disease and disability, repairing vital services such as telecommunication and transport, providing temporary shelter and emergency health care. Disaster mitigation. It means minimize the effect of disaster. The mitigation phase differs from the other phases because it focuses on long-term measures for reducing or eliminating risk. This involves improving structural qualities of schools, houses, and such other buildings so that medical casualties can be minimized. Ensuring the safety of health facilities and public health services, including water supply and sewerage system, to reduce the cost of rehabilitation and reconstruction. The implementation of mitigation strategies can be considered as part of the recovery. Now we see the disaster management. Disaster management is discipline of dealing with and avoiding risk that involves preparing for disaster before it occurs. Disaster response, for example, emergency evacuation, quarantine, mass decontamination, etc., as well as supporting and rebuilding society after natural or human-made disasters have occurred. The International Federation of Red Cross and Red Crescent Societies defines disaster management as the organization and management of resources and responsibilities for dealing with all the humanitarian aspects of emergencies, in particular preparedness, response, and recovery, in order to lessen the impact of disaster. It is continuous process by which all individuals, groups and communities manage hazards in an effort to avoid or ameliorate the impact of disaster resulting from the hazard. In India, the headquarters of disaster management is located in Delhi, where in Gujarat it is in Gandhinagar. They provide various activity and training related to disaster management and others.
Triage is the process of determining the priority of patients' treatment by the severity of their condition or likelihood of the recovery with and without treatment. The rations patient treatment efficiently when resources are insufficient for all to be treated immediately. Influencing the order and priority of emergency treatment emergency transport or transport destination for the patient. There are mainly 4 color codes used in the triage: red, yellow, green, and black. There is a triage tag in a prefabricated label placed on each patient who got stuck in disaster. So, through this tag, we can identify the need based treatment. Red, immediate or the highest priority. This type of categorized victims need first treatment and they have very few chances of survival. Problems with respiratory airways, which goes up to 30. P. Perfusion or pulse, which means rapid pulse. M. Mental status, unconscious or conscious, or heavy injury like crushing the head, or we can say 40 to 70% burn patients. Severe burns which compromise airway. Yellow, delayed or second priority. Burn patient without airway problems, major or multiple bone or joint injuries, back and spine injuries. Green means minor or third priority. We can also say walking wounded. Means ambulatory patients. Minor painful swollen deformities like sprains, minor soft tissue injuries like minor burns, and they can wait for the several hours without treatment. Black, dead or non salvageable, lowest priority. Non breathing patient, resuscitation would normally be attempted. Now we see the different role at the level of education of disaster management. Role of educational institution in disaster management. Act as a safe shelter, health center for the locality, disaster management information center where database could be maintained on population, health, institutions, etc. A center of learning and counseling. The school can be feeding center, training for DRM volunteers, village council members, teachers, government officials at subdivision level. Schools are responsible for not only teaching disaster management knowledge but also serving as education shelters. If a disaster happens during school hours, school must consider the risk that students are exposed to and respond early to such an event. Protect the students and staff from physical harm, provide training and education, and also arrange the conference related to disaster management. Here, the DRM stands for Disaster Rescue Management. General awareness in school. Role of teacher. Teachers should be prepared and be trained for disaster issue. There are mainly 3 types of training. First, training before services. Second, training at the time of starting the services. And third, in service training. This training must be appropriate. Awareness should be generated by teacher on different type of hazards and the preparedness measures to be taken to combat this disaster. Prepare a contingency plan for the school in case of fire, cyclone, earthquakes and floods. Students should be
told about primacy escape route in the school. Train the children on first aid and rescue operations. Carry out mock drill in the school at least twice a year. Initiate the process of plantation in the school and giving knowledge on the type of trees to be grown. Generate awareness on water and sanitation among the children. The students should be demonstrated the actions to be taken when trapped in fire. Now we see the role of school students in disaster management. Knowledge on first aid, rescue and evacuation. Help in preparation of the school disaster contingency plan. Aware the parents and community on various types of disaster hazards and the preparedness measures to be taken. Plantation in the school premises. Boosting the morale of community after the disaster. Senior students can help villagers in preparing the village disaster preparedness and response plan. The students can be volunteers in the first aid team, rescue and evacuation team, early warning team in their village or city. I hope you all are enjoyed our presentation. Thank you.